Thanks to the kind presentation. And in this presentation, we are, sorry for my English, I'm not native English. And in this presentation, there are many words I'm not used to because we have done a systematic review with the Polytechnic engineer of the Polytechnic of Valencia about the use of AI. Of course, we are talking about AI today in neonatal intensive care. As you see in the slide, NICU are complex clinical entities that offer trans-specialty advanced medical intervention, respiratory support, and real-time physiologic monitoring to optimize survival chances and promote a real development in this context. The possibility of using AI are extensive. In NICU, extremely preterm infants are at risk of several injuries and often cannot tolerate scanner manipulation. Besides, our patients sometimes get worse and clinical signs may arrive too late. This is why we use a lot of devices to collect information on organ health through continuous monitoring. Most of this monitoring is not invasive to avoid the many complications of invasive monitoring. Newborn with gestational age over 20 weeks and 400 grams are exposed to extreme health risk complications, handling for respiratory, nutritional, neurological, microbiological disorder. Neonatal care can witness a profound transformation with the advance of innovative sensor techniques and advanced monitoring strategy, including multimodal biosignal acquisition and video tracking techniques. We decide to explore the application of AI in NICUs, identify key trends in AI-driven technology and their roles in diagnosis, monitoring, and forecasting of neonatal conditions. In this context, we do a systematic review we conduct a systematic review across Medline, NBASE, Cochrane, and EEE Explore. The studies included were studies being between January 2013 and December 2023. The keywords were NICU, neonates, AI, machine learning, predictive modeling, and big data in the full test. The eligibility criteria for the inclusion of each record were individually evaluated by title and abstract, and selected records were analyzed according to exclusion criteria. The exclusion criteria study does not include trial conducted in NICU, does not describe data modeling, does not present clinical outcomes, and record in language other than English or published more than 10 years ago. The inclusion criteria were retrospective or prospective study with clinical outcomes in NICU, with methodology for data modeling and sources on data known. In this slide, you can see the program uses to obtain descriptive graphical visualization. Quantitative and qualitative data from this collection process were further analyzed to describe the state of art and the use of application of AI approach in NICU healthcare. Here, you can see the follow discharge of the process. A total of 318 studies were retrieved after removing 61 duplicates and screening 257 articles for the eligibility criteria. 46 studies were assessed for fully text eligibility, leading to a final inclusion of 41 studies. 12 category and 40 data indicators were collected from the retrieval records. Indicators were adapted from the CHARM guidelines. We focus on the objective of the clinical trial and the use of AI, the accessibility and the quality of data development process, the methodology employed in designing and developing of AI models, result obtained, and the discussion provided in the report. Most of the study used private data, and most of the study used physiological parameters and did not mention missing data. Most of the study were designed as experimental and observal trial. Regarding how data were treated, the majority used single group data and some used comparison of versus control experiment or crossover arm trial. Most of the study report the sample size. 15 study included 11 to 50 participants. 10 study included 51 to 100 participants. 7 included 101 participants to 500 participants, and 2 study included more than 500 participants. 70.7 study lacked the validation procedures, highlighting a critical gap in methodological rigor. The predominant domains of AI application were cardiovascular conditions, followed by brain conditions, respiratory difficulties, infection, digestive function, and microvascular diseases. Regarding the purpose of AI application, prognosis was the most common, followed by classification, monitoring, and system forecasting. The most commonly used type of data across the selected study consists in physiological data, like heart rate, oxygen saturation, followed by imaging data, measurement data, and other data. These models were implemented on a specific predictor select for each disease or parameter of interest. Half of the model use combination of data. The studies employ a variety of AI approaches, including deep learning, in 47% of the study, almost a half, traditional machine learning, 31%, and ensemble learning methods. The most popular family of algorithms was convolutional neural network, followed by random forest, logistic regression, and support vector machine. 5% of the study used key neighbors, nearest neighbors, naive Bayes, and XGBoost. The main challenges we have detected are differences in maturity between patient groups, which affect AI models' performance, confounding factors due to the surrounding environment, and the bias arising from non-invasive monitoring in many parameters, even though it is continuous and prolonged over time. Also, data collection among the most critical patients is difficult due to the even distribution of the cases, which affect the reliability of subgroup comparison. Challenges in applying AI in NICU involve high cost of collecting the necessary feature of AI models, overfitting in deep learning models, the lack of generality due to the study being conducted in single hospital. It is necessary to improve the representation of complex signals such as EEG and to address the challenges of dataset imbalance. And it's also important to view think about data privacy, algorithm interpretability, and ethical consideration. Most of the previous study did not mention missing data. However, as we report in our study of analysis of fractional cerebral oxygen extraction in preterm infant during the kangaroo care, before analysis, it is necessary to perform pre-proceeding to remove artifacts, synchronize screening input data, and detect algorithm error. It is necessary to transfer the analysis of clinical data to NICU monitoring and enable this visualization in real time at the bedside of the patient. To achieve this, it will be necessary to improve model validation and generalization through larger multicenter dataset and the incorporation of additional data types. It will be necessary to develop home monitoring system and conduct prospective study comparing new technology with current gold standards. And also combine monitoring system with advanced neural network techniques and develop more efficient model for researchers constrained environments. Key areas for future development are the external validation of algorithms, performance through cross-institutional collaboration to identify clinical correlation in larger cohorts, improve model generalization for false alarm detection, expand dataset for detection of early pathologic condition, evaluate technology in different clinical settings, and adopt an integrated approach to the patient journey. A significant underexploited opportunity in NICU lies in the use of big data and AI for real-time monitoring in clinical assessment. Continuing generalization of high-frequency data for various monitoring systems such as heart rate, oxygen saturation, respiratory patterns, and EEG provide a well of information that remains largely underutilized. Integrated advance of AI techniques with big data analysis allow this information to process in real time to detect physiological changes, predict a clinical event, and offer actionable insights to clinicians. This review underscores the importance of interdisciplinary collaboration in advances healthcare through technology. As computational sophisticated and healthcare data more accessible, the potential of this model to revolutionize healthcare from predictive diagnosis to personalized treatment plans is immense. The significant benefits of AI in NICUs include improved patient outcomes and enhanced operational efficiency. Thank you.